So you ready to start studying for this exam?
Sure.
Alright, what's leukemia?
A cancer that occurs in the bone marrow, and there are two types, acute lymphoblastic leukemia and acute myelogenesis leukemia.
Okay.
Okay, what's the patho?
Acute leukemias occur when white blood cells are released from the bone marrow into the bloodstream before they're mature, and they quickly reproduce. In acute lymphoblastic leukemia, the lymphoblasts are abnormal and they are in abundance and take over normal white blood cells. This occurs in children ages 2 to 5. In acute myelogenous leukemia, it affects the myeloid cells or precursors in the bone marrow, which causes cancer cells. This is typical in the first 2 years of life. What are the symptoms of ALL?
Fever, fatigue, frequent infections, swollen or tender lymph nodes, paleness and easy bleeding or bruising, also bone and joint pain. What are symptoms of AML?
They both have similar symptoms, but fever, night sweats, shortness of breath, weakness or fatigue, easy bruising or bleeding, bone and joint pain, pain or feeling full beneath the ribs, painless lumps where lymph tissue occurs around the neck. They can be blue and purple, and if they occur around the eye, they may be blue or green. What are some treatments?
Chemo and radiation therapy, which stop leukemia cells from growing. Immunotherapy, this accelerates the immune system. Also bone marrow transplant, which replaces leukemic bone marrow with leukemic-free bone marrow. What are some chemo meds and what do they do?
Chemo meds include prednisone, which decreases the swelling that causes cancer pain, vincristine, cyclophosphamide, and daunorubicin hydrochloride cause cancer cell death. Methotrexate and Gleevec stop cell growth by manipulating cell DNA. The patient will also be on antibiotics to prevent infection since they are immunocompromised. Epoetin, which helps to make new blood cells. Allopurinol, which prevents kidney problems. Antiemetics to help control the nausea and vomiting from chemo. What can you teach a patient who has leukemia?
They need to know what to expect. They need to be proactive in their treatment, have a strong support system, have reachable goals. They also need to set time for themselves and stay active. You also want to teach them pain and relaxation techniques.
Good job.
You too.